You're listening to Rise Above, a Rogers Behavioral Health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction. Hello, listener. Welcome to another episode of Rise Above, a podcast from Rogers Behavioral Health. Today, I wanted to talk about opioid addiction. I know it's something that I've heard about a lot in headlines and on the news, but for many people, it's more than that. Maybe it's a friend who's been struggling. Maybe it's a family member who you've watched struggle for years, or someone in your community whose life has been turned upside down. The crisis touches everyone in some way, and today I wanted to talk to a few people here at Rogers Behavioral Health who are working on a program here, a new program that is looking to address opioid addiction head on. So with me today is Christina Munchow, Addiction Services Liaison, and Paige Feller, Clinical Operations Supervisor at Rogers Behavioral Health. So Christina, you've been on before. We talked about your journey and this program that you're working on. You want to give us a quick update or a quick review of what that is?
Yeah, absolutely. I'm so glad to be back with you today. Thank you for the opportunity. The last time that I was on, I gave a broad overview of a new program that we've been working on, and it's called the Worth It program, and it's an acronym, and it stands for the Wisconsin Opioid Recovery Telehealth Immediate Treatment Program.
I was
And
hoping you'd let me guess.
I know it's an easy one to guess, isn't it? But the program is really exciting because we offer immediate same-day access to prescriptions for opioid use disorder, regardless of an individual's ability to financially afford those medications, regardless of whether or not that individual is insured or not. And we've really worked hard to try to remove those barriers that traditionally have stood in the way of folks gaining access to treatment options across the state of Wisconsin. And how we've been able to do this is because of funding that we received, made possible by SAMHSA and the Wisconsin Department of Health Services through the state opioid response grant.
So, Paige, I'll ask you, what makes this program different from like a traditional opioid treatment program?
What doesn't make the program different? I think that there are so many things that we have done to try to identify and eliminate barriers. And a lot of the traditional programs unintentionally result in barriers that would prevent some clients from receiving treatment or services that they need. And again, like I said, we work to eliminate those barriers. A couple things that instantly come to mind is insurance or financial status, things like childcare or work needs, so schedules that may interfere with clients being able to seek treatment or to stay in treatment or to attend a full duration of treatment. The requirement even just for on-site treatment and transportation or other barriers that could prevent that from being possible. A lot of traditional programs have strict requirements for recommendations that are made by the treatment team and following those recommendations, whether it's attending 5 days a week or 3 hours a day or all of the above, as well as even just toxicology screenings and other things that our program still strongly recommends, but wouldn't lead to discharge or refusal to admit someone to our program if they weren't able to meet those needs or follow those recommendations. Those are some of the common barriers that we hear about that we've worked really hard to eliminate in this program. Beyond that, clients really are in charge. And so they choose their own adventure. They tell us what they want. We rely heavily on ASAM to do thorough assessments and make clinical recommendations and explain the rationale behind those recommendations. However, ultimately, we let clients choose the level of care that they receive, the amount of treatment they receive, the goals that they focus on, and empowering them to make those decisions and really stressing the autonomy goes a really long way, not only in them seeking treatment with us, But oftentimes we find that by meeting them where they're at in the moment, down the road, whether it's a couple of days, a couple of weeks, or even months, clients recognize that maybe they did need something more or something different. And because we meet them where they're at, they can recognize that on their own terms and with our support, and then are open to a higher level of care.
Sure. Now you mentioned like transportation barriers. Um, the Worth It program is like telehealth, right?
Yep. So our program is fully telehealth, which includes phone, or it includes screens. If someone has access to a tablet, a computer, etc., we use Microsoft Teams for video calls if individuals are interested in video abilities, and otherwise, as long as they have access to a phone, it doesn't even have to be their own, we can have phone call services.
Christina, with your unique journey and your perspective, how does the Worth It program's access break down those barriers?
Yeah, so I think this is a really important conversation to have. As someone who has struggled with addiction, specifically with the use of opioids, I vividly remember when I was at a place where I was ready to start trying to access care or treatment or just figure out what my options were. One of those times I had no insurance at all. And for those who may not be as aware of some of the struggles for folks who are uninsured trying to gain access to treatment, it is really difficult. You would be hard pressed to find many options available to you financially or otherwise to be able to gain access. You need to have a vehicle typically for transportation to and from treatment. You have to have insurance, you have to have the financial ability to be able to cover those costs. And so for me, when I look at this program, it makes me really happy and really grateful to be able to be a part of bringing a solution to folks who otherwise, like myself at one point, would not be able to gain access to those services. And I think that when we have somebody call into the Worth It program, not only are they provided access to medication, I think that's incredibly important. I talked about that the last time that I was with you, but these folks are also being connected to case managers, folks who have so many different resources at their disposal for the entire state of Wisconsin for people who might be struggling. And again, I cannot stress this enough. You do not have to have Wi-Fi, you do not have to have transportation, and you do not have to have any insurance in order to be able to take advantage of these services. You just have to be in the state of Wisconsin. So for me, if this program had been available when I was still struggling, I think that would have been such a game changer to be able to be that connection point for me.
And now, Paige, so Christina mentions a phone call. You make a phone call. What does it look like after someone makes that phone call?
Absolutely. We have schedulers answering phone lines Monday through Friday from about 8:30 a.m. until 8 p.m., ready to support individuals who call. Our scheduling team can answer questions about the program, can provide a little bit more information, and if an individual is interested, they gather some basic information to be able to ensure appropriateness for our program and then to get them scheduled. Again, same day if they're interested, or next day, or at their convenience. They have an intake appointment scheduled. So the pre-registration process is intended to be fairly quick and painless. Basic information is gathered. Consents do need to be obtained either verbally or they can be sent to email if individuals have access. And then we get the appointment scheduled, and right away they are able to meet with a nurse, a provider, and a clinician for that intake appointment.
And we will be right back. Real quick, I wanted to take a moment to talk to you about WISE, the Initiative for Stigma Elimination. It unites people across the nation to support those touched by mental illness and addiction. The compassionate approach champions personal stories and powerful connections, fostering healing by reducing stigma through evidence-based practices. Rogers Behavioral Health supports the work of WISE through their Community Learning and Engagement Department. WISE collaborates with a diverse network of organizations and individuals united in the fight against stigma. You can learn more about WISE, explore their 4 key programs, and connect with them by visiting the website www.eliminatestigma.org. And now back to the interview. So, Christina, from your perspective, what do you think would draw someone into this program?
So from my own experience, I think the ease of access is probably number one. So many individuals don't have access to transportation, or they do have access to transportation, but maybe it isn't reliable transportation. And for anybody who's listening who has battled through addiction, specifically with opioids, you will be able to relate to what I'm about to say. A lot of addiction medicine providers, typically you have to go in person for a recurring appointment at the exact same time every single week. And sometimes there is flexibility from those providers on dates or times. And if you are unable to have access to reliable transportation to make it to your appointment in time, you might be out of luck in obtaining the next week of your prescription, for example. And so for folks who don't have that, but really do have that want to be able to enter recovery on their terms, I think that the point of accessibility and the ease of access that we've created within this program, personally, I think that's a huge draw. And I think the other piece of this, just because I am a woman and I'm a mom who is in recovery, for me to be able to have access to a program that I do not have to find childcare for, or I don't have all these other barriers that so many parents or moms in general have when they're trying to gain access to treatment, is so crucial. And so I think there's a few different things that draw people into this program. I think those are 2 really important ones. And I would say that the third is for those folks who are uninsured or are underinsured, to still be able to have access to the same opportunities of treatment as anybody else might have.
And I know earlier you mentioned medications. What are we talking about with medications in this program?
Yeah, so the medications that we are specifically talking about when we say medications for opioid use disorder, because that can cover quite a range of medications. We in this program are specifically centered around buprenorphine, which is a really fun word to say. That's why we left it out of the name of the program, because it is a hard word to say.
I'm not going to try to say it. Go ahead.
Yeah, how I explain this, because it is more complicated. Every single one of us are born with opioid receptors in our brain, which is fascinating to me. And a lot of people do not know this. But when we are using opioids in active addiction, those opioids are coating those opiate receptors in our brain. And that's what's making us feel good. When those opiates begin to go away, and we don't have more opioids to be able to replenish those receptors, that's when withdrawal happens. And so what buprenorphine essentially does is it comes in as a partial agonist and it coats those receptors and it calms those receptors down, right? It also at the same time can help block cravings. And for me personally, in my early recovery, I utilize buprenorphine. I'm not ashamed to say that. I say that very proudly. I think that it really helped me get my leg up and be able to stand on my own 2 feet in the early days of my recovery, because it was not just coating those receptors, but also helping block those cravings. And so for folks who are addicted to opioids, buprenorphine is really considered a life-saving medication. But traditionally how it's prescribed is in a form called Suboxone, right? And that's a strip, sublingual, you put it under your tongue or in your cheek and it slowly dissolves. And the reason I'm kind of getting into that piece of it, for those who may not understand the breakdown of it, Suboxone is a combination of buprenorphine and naloxone, right? And so I think our medical providers could probably explain this a lot better than I can. And essentially what that naloxone does is it's creating a ceiling, right? And so there's a safety mechanism that's built into it. If I take that Suboxone strip and I want to go and relapse and go use, I'm really not going to be able to feel anything because that naloxone is blocking those opioids. And so it's a life-saving medication, number one. Number two, it helps folks get back on their feet in the early portion of recovery. And then we also now today have an injection, which is called Sublocade, which is a once a month injection of buprenorphine that has shown really great efficacy just in all the trials. And I myself transitioned off of Sublocade without any issues. And so I enjoy talking about it, but the science can get complicated sometimes for folks. But that's essentially a breakdown of the medication and why it is so important for folks struggling with opioids.
And now, Paige, it's medication, but it's not just medication, right? There's other things involved.
Yes. As Christina said, our program largely focuses on buprenorphine as the medication for opioid use disorder. However, there are currently 3 FDA-approved medications that can be prescribed by our providers for individuals who are uninsured or underinsured. Buprenorphine is our go-to medication that is prescribed for a variety of reasons. It lends itself particularly well to our low threshold telehealth approach. Christina talked about some of the safety mechanisms. There's a lot of flexibility with types of prescriptions. It can be started in multiple settings. It's proven to significantly decrease risk of overdose and be safe overall. And individuals are able to have quick access to those medications. Beyond the medications, I talked earlier about kind of a choose your own adventure that clients get to be in charge of. And so for most individuals, that first appointment is focused on the medical assessment, the background information, and getting that prescription written to them day of. If there are safety needs or clinical concerns, we have a clinician available and willing to meet with individuals on day one. However, our priority is usually getting them access to the medication that they're looking for, hopefully avoiding any withdrawal symptoms, mitigating any concerns from that standpoint, and then moving on to that choose your own adventure. So we offer a variety of clinical services to include individual therapy, group therapy, support sessions with family members, loved ones, supportive individuals. We offer case management, which is in a lot of ways anything under the umbrella of meeting basic needs that are priorities to individuals who come into our program. A lot of clients need help finding reliable housing or food or other resources. And so our case managers can connect individuals with a variety of resources that are critical to their well-being, their stability, their success. We offer ongoing appointments with our nurse, with our provider for that medication management. And in a lot of ways, we ask clients to tell us what they need and what we're looking for, and then we do our best to provide it to them between our case managers, our therapists, our providers, and our nurses.
And we will be right back. Everyone deserves a chance for recovery. That's what drives Rogers Behavioral Health Foundation. They're helping people get the mental health care they need, from covering treatment costs for those in need, to building clinics where care is hard to find, to funding cutting-edge research. They're making real change happen. And guess what? You can help. Head to rogersbhfoundation.org and be part of creating a future where mental health and wellness thrive. And now back to the interview. Is it too early to talk about success with the program? I know it's been a few months since the program has started. I guess, what does success look like, and have we seen success?
I love that question. And our program opened statewide at the beginning of October. So we've had just over a month of opportunities to evaluate, to gather data, to explore what success looks like in our program. My initial response is to reference data points. I'm thinking about clients we've been able to serve, especially underinsured or uninsured individuals who otherwise would not have access to treatment. I'm thinking about the number of counties or tribal organizations that we've connected with from an outreach perspective, and then individuals who have come to us for services. We complete regular assessments that are reflecting improved quality of life, improved protective factors overall, decreased risk factors. However, I think far beyond those actual data points, and especially with only 30 days of statewide programming, I think every phone call speaks to itself. Every phone call that's answered, every appointment that's offered, every medication that's prescribed to our clients. We have heard numerous times since opening that this program has truly been life-changing and life-saving. We hear from family members who have connected with us who now have increased understanding of substance use as a brain disease and not a choice or a moral failure or a struggle due to their own behaviors. And so all of those things, I think, are major wins as we think about what success looks like in the last month. It's a little bit too early for concrete data points, but since opening statewide a month ago, we've exceeded our program goals in terms of serving patients. Our schedules are filling up, our phone lines are busy, the feedback from clients is overwhelmingly positive. We have an incredible team. And so I think all of those things are a clear indication of success.
That is great. And now I know I might be pushing it here. What are the plans for the future? I know it's so early, but do you see this? Where do you see this going?
We already have a team full of individuals who are asking how we are prepared to respond to the increased number of individuals calling, the interest in our program, etc. And I think all of those are great problems to have. We are hopeful that as our program expands, we will be able to expand with it in offering services and meeting those needs. And so again, with about 30 days of statewide data and so many counties and tribal organizations that we have yet to connect with, it's hard to say what the trajectory is going to look like. And it appears we will be busy meeting people's needs. And so we're prepared to pivot and expand with our program. We're hopeful that it becomes a long-term self-sustaining program and that we're able to continue truly saving lives and meeting so many unique needs.
And I know I talked to Christina about this the last time I spoke with her, but for you, what is the most rewarding thing about working on this program?
I think some of those successes that we just touched on, it's easy for me to dream big and focus on long-term goals and big picture of how many lives we can change and lives we can touch. And when I think about, if I had a loved one who was in this exact position and needed this, that's a success in and of itself. And so every client that we can serve, every success story that we hear, not just the big successes like somebody ending up, achieving and maintaining recovery, but somebody thinking about returning to a substance and then calling us instead, or somebody saying, I'm not ready to stop using, but I want to make safer choices or I want to explore options. I think every seemingly tiny success story really just fills my heart and gives me motivation. And it's just so wonderful to see such a variety of individuals who can receive services for, again, essentially anything under the sun. Tell us what you need and we'll find a way to meet that need. And that's one of the coolest things.
So, Christina, if someone's listening right now and struggling, or maybe they know someone who they feel is struggling with opioid use, what would you want them to know, or what would you want them to hear, or what would you say to them?
Yeah. I get asked this question a lot, and I hope I never stop receiving the question, because I think it's important, again, to have that conversation. I think so many people who have a loved one who's struggling, or maybe if you're the one who's struggling yourself, I think there's a lot of people that kind of try to dance around, like they don't exactly know what to say, or they're so desperate, they don't know what to do anymore, and they've tried all these things. And if you're the person who is supporting that person, I just want you to know that being there for them and being that safe space for them to call, right? At the end of the day, we all need somebody who's there for us, someone to talk to us, someone who is willing to just listen unconditionally. And so if you are someone who loves somebody who is struggling, just being there and loving in whatever way that you can, I think is enough. And if you are the person who is struggling, like I once was, I think knowing what is out there, having an understanding of the resources that are available is half the battle. I don't think that in this field in general, we always don't do the greatest job of getting those resources out there or getting the word out there to the people who need it the most. And so I would want to know about these resources. I would want someone to share this information with me. Even if I wasn't ready right in that moment, I know that I have this option available, that there is hope available. And so sharing the resources, being able to be there and support someone in whatever capacity that might look like in the journey. And just knowing that there are a ton of people out there who truly care about you, want better for you, and will hold that space for you until you're ready to make some of those bigger changes. I think that's everything, personally.
And now, Paige, before we go, I realize we talked all about making that first phone call or reaching out. We haven't mentioned a number yet. What's the number they're calling?
For anyone who is interested in learning more or scheduling that initial appointment, they can call 844-582-7827. If they would prefer to send an email, they can email our team at worthit, WORTHIT, at rogersbh.org.
Christina and Paige, really great information. I appreciate you coming on the show with me today.
Thank you so much for having me again. It's always so fun to talk with you and to be able to highlight some of these programs. So thank you.
Thank you so much for having us and allowing us to share some information about this amazing program.
Well, listener, thank you again for tuning in to another episode of Rise Above from Rogers Behavioral Health. As we talked about today, opioid addiction is not a battle that anyone should have to fight alone. And the Worth It program at Rogers helps provide a resource that people can reach out to if they're struggling, if someone they love is struggling. Again, the number for the Worth It program is 844-582-7827. And the email is worthit, WORTHIT, at rogersbh.org. I'll have all that information in the description for the episode as well. And if you or someone you love needs the help, don't hesitate to call that number or use that email address. That is what it's there for. So thank you so much for listening to Rise Above, a podcast from Rogers Behavioral Health. Be sure to like and subscribe to be notified of new episodes. And as always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening. Until next time, thanks for listening.